Good afternoon, everyone, and welcome to the Board of Pharmacy's webinar today. I'm Tom Glinski, Chief Inspector with the board, and with me today is Inspector Dan Vandersand, who will be helping me with the webinar. Before we get started, for those that haven't been on a webinar before, I'll go through a few slides to explain some things to you. Everyone is in listen-only mode, and if you have any audio trouble, with your computer, there is an option on your toolbar to call in over the phone to get the audio. So if you're having any trouble on audio, please do that. The program today has been approved for an hour of CE. Now I do get questions, do we give CE for technicians? Yes, anyone is on, you will get a CE. And then the other questions, since this is for technicians, pharmacists want to know, will they get CE? And the answer is yes. You will also get CE. You must be logged in to the program yourself. You can't be logged in under anyone else's name or sharing a computer. At the end of the program, I'll give more instructions on the how to get CE. And we do not submit to the CP monitor, so make sure you save your certificates. We do have handouts that can be found on the board's website under the upcoming events tab on the left. We also have them posted on the GoToWebinar toolbar, which is, you can see here on the screen how under the handout sections, you'll see them posted. We do make a recording of all our webinars that can be found on the board's website under the videos and webinars section. We hope to have time at the end to answer questions. If you'd like to submit us a question, you can go to your toolbar, type it in and hit send, and at the end we will try to answer some of those questions. So today's webinar, I have it broken down into different topics. We'll talk about roles and responsibilities of a technician, some regulation updates that that affect technicians, some compliance issues related to what technicians do. I'll give you some updates on some resources we have for you. We'll have a discussion on some technician well-being issues. And then, as I said, we'll try to answer questions at the end. So what is the pharmacy technician? So by regulation, it's someone who is assisting in the practice of pharmacy or someone who has independent access to the drug inventory. Those people are required by law to register with the board. Sometimes we get answers, do I have to work in a pharmacy in order to be licensed? And the answer is no. You can file an application without being employed in a pharmacy, or if you quit your job, you can continue to keep your license. We get a lot of questions about certification, pharmacy technician certification programs. The Board of Pharmacy license is not a certification program. Certification is not a requirement for Board of Pharmacy licensure. However, there are certain activities that are now technicians can do that require the technician to be certified, and I will talk about those later on future slides. But there is a difference between certification and licensure with the board. There are some activities that technicians are prohibited from doing. Here's some that are specifically spelled out either in our regulations, or the first one is also in DEA regulations. Unable to transfer a controlled substance prescription to another pharmacy. That can only be done pharmacist to pharmacist. Technicians cannot perform data entry verification or final product verification. Technicians cannot counsel a patient, and that includes counseling them on OTC items. So if a patient comes to your counter and says, what would you recommend for a headache? A technician should not be providing that information. It should be a pharmacist. A technician cannot independently override a DUR message or make any kind of clinical judgment call. And then they are prohibited from applying a prescription label to a previously sent prescription at a long-term care facility. Pharmacists must verify the work of a technician. These are examples of things that must be checked by a pharmacist. Filled prescriptions, so pharmacists must check it for its contents and also the labeling on it. Compounds, both sterile and non-sterile, that needs to be checked by a pharmacist. Reconstitution of a product, so if a prescription for an oral antibiotic suspension in dry form is prepared and they're waiting to mix it once the patient comes to the pharmacy, if a technician and a pharmacist has already checked that, if the patient comes in, a technician reconstitutes that, it still must be checked again by the pharmacist before given to the patient. And then any kind of data entry of prescription data into the pharmacy computer system must be checked by verified by a pharmacist. Technician responsibilities. One is you need to keep your license current. They renew every year, expire on May 31st, and that's yearly. You're also required to keep your address, employment, and name changes up to date, and these can be done electronically online. On the left side of our website is a tab that says Online Services Reporting, and you can find a link to do these things there. I believe name changes requires you to send in some further documentation though. Other responsibilities is to respond to board correspondence, and types of correspondence would be if you have a pending application, a lot of times the board will be sending letters about your application asking for more information or other things. You need to make sure you respond to those. There's House Bill 600 suspension notification letters. I will talk more later on in the program about what House Bill 600 tax suspensions are, but they do require an action on your part, and you should respond to those. You could get requests from inspectors, that's during an inspection or during an investigation. Inspectors do request stuff from technicians. And then the board could just be sending out any general letters to a technician that they need to respond to. Another responsibility is just to stay informed, and a good way to do that is sign up for our email or text alerts if you're not already signed up for those. You also get announcement when new newsletters are coming out. We just had one of those last week. And on our website is a link on the home page that easily lets you sign up for those. Another responsibility is you need to be honest with your employer. An employment application is a prime example that needs to be filled out correctly and honestly, especially when it comes to criminal history and charges, and not only on applications, but on renewals. And should you be charged while you are employed or get a conviction, your employer needs to know about that if they handle controlled substances. They're under the requirement that they may need a waiver in order for you to be employed if you have a past drug conviction. It all depends on what type of conviction it is. Both DEA and BNDD, which is the Bureau of Narcotics and Dangerous Drugs, that's the state agency in Missouri that regulates controlled substances, do require waivers to employ people with past convictions. And then, as I mentioned earlier, if you get any kind of House Bill 600 tax suspension notice, you need to let your employer know that. And then any kind of Board of Pharmacy discipline, if you would be disciplined by the board, you should let your employer know that. You need to be honest with the board and the inspectors through the application process and renewal process. You're asked questions about criminal history. You're also asked about substance abuse is also asked on the application. You need to be honest with that in answering those questions. During an inspection, inspectors will ask technicians on what processes are in the pharmacy. Ask them what they're doing or how they do something. You need to be honest. Don't tell us what you think we want to hear. Please tell us what actually goes on in the pharmacy. And then during investigations, technicians will be asked to provide information on something we might be investigating at a pharmacy. You could be asked for a formal interview with an inspector, sit down with a formal interview at times, especially if we're investigating something in your past or something that you've done. So I encourage you to always be honest with the board and their inspectors. You need to make sure you're properly trained. Employers have employer training. Don't be willing to do a task you haven't been trained on. We do find that occasionally where people are doing things and we ask them, you know, what was your training? They said they had no training on that. Policies and procedures. Pharmacies have policies and procedures covering many different topics. You need to know what they are. You need to review them on occasion, and you shouldn't be afraid to speak up if you don't understand them, or if you need training on the policy or the procedure. Sometimes what we find out is the policy isn't really what is happening. You should speak up if that's what's happening at your pharmacy. And also speak up if you have a suggestion for how to improve the pharmacy. Usually employers are happy to receive suggestions for how they can do things better. Over the years, I've heard pharmacies tell me that technicians were the ones that came up with an idea, something that they were doing that they thought was a great improvement. So don't be afraid to speak up. You should know know what to do in cases of certain things happening in the pharmacy. Would you know what to do if a coworker came in impaired? Do you know what to do if you have your own substance abuse issue? Have you been trained on what happened in case your pharmacy is robbed? What are you to do during the robbery? Have you been trained on that? Everyone probably has had some type of HIPAA training, but you need to know not only what HIPAA is and what a confidentiality breach is, but how do you report that if you see one? Would you know what to do if you witness drug diversion or other theft in a pharmacy? Do you know how to handle a fraudulent prescription if it's presented to you at a pharmacy? Healthcare fraud is another one. I have a slide on that in a couple slides. We'll talk more about that. Do you know what to do if you witness other employees failing to follow procedures? And do you know what to do in case you find someone violating pharmacy laws or regulation in the pharmacy? So those are all things, if you don't feel comfortable, you should ask your employer to provide you more training on that. Don't be afraid to speak up. Don't be complacent. Don't be afraid to report issues to your pharmacists, supervisors, and management. And if necessary, you can report to the Board of Pharmacy, either through inspectors or directly to the board office. So things you could speak up about, if you're asked, these are things that would be violations. Dispense an outdated drug. We've had technicians tell us before that a pharmacist told them to go ahead and dispense it. That is a violation. You should speak up. Same with misbranding. Misbranding takes a variety of forms, but one is pouring a return to stock vial back into a stock bottle as mixed branding. Technicians have told us before that, that's our policy. We've been told to do that. That's a violation. Creating a fraudulent record, that could be something with healthcare fraud, or just covering up a record, any type of record. If you're asked to cover something up, covering up an error or not reporting an error. Most pharmacies have some kind of error reporting process. So sometimes technicians have been asked to overlook things like that. Speak up if you're asked to practice unsupervised in the pharmacy. I'll be talking a little bit later on about supervision. Speak up if you're asked to sell a prescription when a pharmacist isn't present. Now there are exemptions to this for different classes. F, L, Q, and R have exemptions in those types of pharmacies. But most pharmacies in the ambulatory retail setting do not fall under those, and a pharmacist always needs to be present. Speak up if you witness diversion or theft, a fellow employee impaired on the job, a fellow employee violating policy. Speak up if you see improper drug security. If you see the C2 cabinet is always open, it should be locked at all times unless someone's getting something out of it. Speak up. Unsanitary conditions, outdated drugs, unsafe conditions. Those are things that you might see in your pharmacy, and you should speak up if you and let the pharmacist know there's an issue. Healthcare fraud comes in a variety of different forms. There can be fraudulent billing schemes, which they're just outright making up bogus claims. Could be other times where you're submitting a claim for something, but you're billing for a different drug or quantity than the patient actually got. We've seen billing issues related to failure to reverse claims, and some examples are that of return to stock prescriptions. When a patient doesn't pick up a prescription and it's taken out of the will call bin and put back into stock, if that was billed to insurance, that needs to be reversed before it's put back into stock. Same with nursing home returns. If a long-term care facility is making a return and it's eligible to be reused, if that was billed to insurance or the patient, that should be reversed before the pharmacy reuses it and puts it back in their inventory. And then owed medication, that is when the pharmacy doesn't have the full amount. When someone gets a prescription and they say, we'll owe it, we'll come in tomorrow's order. Pharmacy gets it ready, but the patient never comes in to pick it up. If those get returned to stock, those need to be reversed. And these things these are all functions that usually technicians are involved in some process of these activities. They may not be the ones doing the reversal of the claim, but they're usually the ones handling the return to stock medications and stuff. So those are all examples of healthcare fraud. If you're witnessing, you should speak up. And in patient safety, technicians play a vital role in protecting our patients. A lot of the activity in a pharmacy is done by technicians. If you think about filling of a prescription, from data entry to preparing the prescription to bagging it, and labeling it, all those things technicians are involved in. So we want to prevent errors as much as possible. So some things to do is, when in doubt, ask. If you ever have a question of what a drug is, or you don't understand what you're typing into the computer, ask. Or if you don't understand what the prescription says you're typing into the computer, ask. If you don't understand what the drug is, don't guess. And if you see an error or something that is, speak up. We've actually had times where technicians did not speak up, but did know an error was occurring and was dispensed to the patient. It's good to double check your work whenever possible, and always slow down and stay focused. Avoid distractions, put the cell phones away. You need to be following policies and procedures of the pharmacies. They're in place to help protect patients. You play a vital role in offering counseling to the patients, because it's usually the technician who is making that sell to the patient and who is making that offer to counsel. And then in reporting errors per the pharmacy's policy. So you play a big role there in helping keep our patients safe. I'm now going to switch to the regulation update, and this is kind of the exciting part of the presentation today. But before I get to that, I'll just give you just a little quick lesson on what's a statute versus a regulation. I'm going to be talking about regulations today. Statutes are also known as laws, and this is all through the legislature and the governor. The board's really not involved in these. Regulations, also known as rules, these are what the board, they propose them, they develop them, they draft them. We go through a formal process to turn them into regulation, and then they become official. So today I'm talking about regulations, not statutes. But the exciting part about it is these are ones that are advancing the roles of technicians and allowing you to do more. So what I have to talk about is technician supervision, remote data entry, non-dispensing activities, remote dispensing site, and then immunizations administration. So the first one deals with technician supervision. It was a new rule written last year. It defines direct supervision and what readily and immediately available means. But a key part is it now allows for remote supervision. So it allows technicians to be supervised remotely. So you can be outside of the pharmacy doing things now versus in the past you always had to be in the pharmacy. It also allows you to maybe be in the pharmacy doing things without the pharmacist there. So it advances what certain things technicians can do. Readily and immediately available, and being able to provide assistance is what direct supervision means. Break that down any further, the rule says that to be readily and immediately available, the pharmacist needs to be on the same physical premises or using technology to supervise a technician. So this is a big advancement here of the use of technology. I will asterisk here, point is physical premises for these three activities, the pharmacist must actually be in the dispensing area, not just on the physical premises, but actually in the dispensing area when they're preparing medication, compounding, or dispensing or providing medications to patients. So this does allow the use of technology to supervise activities. Now, some activities cannot be supervised unless you're in a special class of pharmacy, and that would be preparing medication, compounding, or dispensing and providing medications. That is allowed in a class R, which I'll talk about in a future slide. And then the rules goes on to require a certain kind of technology. It's not really specific. And then it does require special training and assessment of the technicians who are being supervised remotely. Now, I'll talk about training and assessment later on because all three of these slides have the same training and assessment. Another rule last year was new was the remote data entry rule. It allows a technician to perform data entry outside of the pharmacy. Prior to this, it could only be done in a pharmacy. So a prime example is this is allowing a technician to do data entry from home. And with COVID, we saw a lot of that happening. We know a lot of places are wanting to continue that to let their technicians work from home. The rules specific talks about different supervision, record, security, policy, procedure, and it also requires that same training assessment I'll talk about in a minute. The rule does require that the location be in Missouri. Now, due to COVID, there is a waiver in place that overrides that. But once the waiver expires, technicians performing remote data entry must be located in Missouri. The waiver is set to expire on August 31st. We are expecting to hear any day now an extension from the governor's office, but I have nothing to announce right now that it's been extended. Non-dispensing activities was a revision to an existing rule. That existing rule talked about what a pharmacist could do outside of a pharmacy. This has been revised now to allow technicians to perform certain things outside of a pharmacy, so that as long as certain requirements are being met on supervision, technology, again, training and assessment, and security. So it opens up. People say, well, what kind of activities could I do? Well, some that come to mind is I am a community health worker. That's a person who goes out and assists people. We have technicians out there, pharmacies using their technicians to do that function. We also have had over the years pharmacies who want to put technicians at a physician's office to assist with things. And now those activities are allowed. The technology that I talk about, it doesn't have to be full video, audio. Depending on what the activity is, it could just be audio communication through a cell phone that you're able to reach a pharmacist if need be. But each of the rules have specific stuff built into them. The training assessment, though, that I talked about on all those slides is the same for all three rules, and there's two requirements. The employer must provide training in those activities, and the technician must have an initial and annual documented assessment of the competency that they have in those activities. So that is required for all three of the things I just talked about. Again, that's anyone supervised using technology, anyone performing remote data entry, or any technicians performing non-dispensing activities outside of a pharmacy. Next thing is a Class R remote dispensing site. This was a new rule that implements a 2020 legislation that created the new Class R type. And basically what a remote dispensing site is, it's a licensed pharmacy, but it is staffed and operated by a technician. It is linked to a supervising pharmacy where the pharmacists there are providing remote supervision and a remote final product verification. So to date, we have, I believe, 5 of those licensed in the state being operated by a technician. The pharmacist is there some of the time, but not all of the time. And the technician is performing all the functions that would normally happen in a pharmacy. So a big advancement here, allowing technicians to work, basically run a pharmacy with remote supervision by a pharmacist. To be qualified to work at one of these sites, the technician must meet these requirements. And this is one of them I talked about earlier, that certain activities require certification. This is one of them. You must hold an active certification from one of the national certifying agencies. I believe there's 2. There's PCTB, and there's, I believe it's called under NHA now, it's the ACCEPT program was what it was called, but I believe it's rolled in under NHA now. Those are the 2 programs certifying technicians. There may be more, I'm just not aware of them. You've had to complete employer training on the activities you'll be doing at the Class R. And again, it's similar in the other rules, initial and annual documented assessment of competency. And then there's also a requirement that any technician working at the Class R prior to working there, have 1 year's experience working as a technician in the state of Missouri. Immunizations and administrations is another advancement that is allowing technicians to do more. Both of the rules were revised to allow a pharmacist to delegate the immunization or administration to a technician. Previously, they could only delegate that to an intern, but now they can delegate it to a qualified technician. Let me go back and explain the difference between the 2 rules. The second one, 6.050, is probably what most of you are familiar with. It's providing immunizations based off a protocol. 6.040 is it's based off a prescription order, and it's not limited to just certain vaccines. Any vaccine or drug, if ordered by a prescriber, could be administered by the pharmacist. And so now, under each of those rules, a technician can be delegated to a qualified technician. But I do have to caution, the pharmacist still must be approving the immunization and administration first before the technician administers the vaccine or drug. Now, due to COVID, there's some conflicts between rules and what's allowed. I'll talk on another slide in a little more detail, but any technicians who are providing administrations under the allowances in the Federal PrEP Act, which would be COVID-19, influenza, or childhood vaccines, should be following the HHS requirements in those declarations, and we would not be following our rules and requirements on this. But again, that's only to the COVID-19, influenza, and childhood vaccines. Any other vaccines or drugs would be falling under the board's jurisdiction in these rules. So to be qualified to provide immunizations or administrations, you must, again, be certified. You must have initial and annual documented assessment in the competency. And then in this case, you have to have 1 year's experience of being a technician either in Missouri or another state for 1 year. So this is different from the other rule I just talked about. This one will allow you to have that experience from another state. And then if you're qualified, then you still must meet the general requirements to do immunizations similar to a pharmacist. So you have to complete a administration training certificate program, and the rule says similar to what a pharmacist has done. You have to hold a current CPR or BLS certification, and the pharmacist must be physically present on site whenever you're providing an immunizations. You cannot be supervised remotely under the rule I previously talked about. We have been asked about can a pharmacist supervise you if you're out in the parking lot doing some type of drive-in clinic. The board looked at that and the answer is no, the pharmacist would have to be physically out in the parking lot with you. And then another requirement is if you're the providing the immunization, your identity must be in the vaccine administration record along with the pharmacist. Now, the COVID-19, as I mentioned, there are some allowances federally that override our requirements. And if the pharmacist chooses to delegate the COVID-19, influenza, or childhood vaccines, then they can follow HHS guidelines. So the guidelines are, they allow more, in the childhood vaccine, it would allow more vaccines than what's currently covered under the board's allowances. And it also lowers the age limit. The board's is set age 7. Under HHS, it would be age 3. So for those, you need to be following the HHS guidance. They have requirements for training, CPR certification, and supervision. And again, our rule doesn't apply, so there's no need for technician certification or the 1-year experience requirement. And then there's also COVID-19 testing that's allowed under the HHS guidance. And again, you would need to be following that guidance if you're being involved in collecting a sample for testing. One possible rule change that's coming up, it's actually would be a new rule. The board is discussing a technology-assisted product verification rule. This would allow technology to be used to check a technician's work. Right now, the rule as drafted is limited just to unit of use packaging. It has similar technician requirements that the other rules that I talked about would have. So this would be a future development, again, affecting technicians. The board will be reviewing this at the October meeting if you're interested in learning more about that. So now I'm going to talk just some of the compliance issues that we run into. Our first start with inspections, some of the things we see on inspections that technicians are involved in. As I said earlier, usually it's the technician making the sale, so they're the ones who should be offering counseling. So we come across a lot of times the failure to offer counseling. It needs to be offered to both new and refill prescriptions. We find technicians actually providing counseling, which I talked about earlier. Another issue is whenever you're handling loose tablets or capsules, such as filling bubble cards for nursing home patients, you need to be wearing gloves. Outdated drugs in the inventory and overfilled stock bottles. Even though that may be not your responsibility, a lot of times it may fall back on the technician who was responsible for a certain section of the inventory to check if they're out dates, or it may be an overfilled stock bottle is usually the result of combining 2 stock bottles together or return to stock back into a manufacturer's bottle. Technicians could be involved in that. Failure to follow policies and procedures is something we would find. And then sometimes we find technicians using someone else's password to maybe place a CSOS order, that's a C2 order, or maybe make an entry into the pseudoephedrine database or make a pseudoephedrine cell. You should not be sharing usernames or passwords to do those items. As I mentioned earlier, you shouldn't be reconstituting anything without a final pharmacist check. We find issues with return to stock labeling and expiration dates of those return to stocks. A lot of times that's a technician's job to return things to stock, and they inadvertently rip off the label or scratch things off the label that should need to stay on. Dispensing errors, since technicians are involved in a lot of the filling process and data entry, a lot of the errors sometimes go back and technicians were involved. Incomplete, inaccurate compounding records and compounding testing failures. A lot of times technicians are the ones actually doing the compounding, and we do test things, and sometimes they fail their potency. And then improper temperature drug storage. If you witness that, if you're the one checking the refrigerator every day for temperature or recording temperatures and you see it's out of range, if you don't know what the range is, you should speak up and let someone know that. Sterile compounding, these are some specific to sterile compounding. Skills assessment and media fills, those are required not only initially but on an ongoing basis. They're not done when due. We witness improper hand washing, garbing, and aseptic technique by technicians. We watch improper technique of failing to disinfect gloves, improper cleaning. We watch technicians clean the hood or clean up the buffer room or area. A failure to document things on your records, and just failure to follow the pharmacy's policies and procedures. Investigation-wise, drug diversion is a common thing and that we investigate involving techs. That could be controlled or non-controlled substances. It could just be outright theft, or it also could just be creation of fraudulent prescription or refills. We investigate just theft of cash, merchandise, food and drink. We've seen a lot to do with gift cards and rewards programs or employees discounts, or undercharging customers or processing credits returns, where a technician has been involved in some of that activity. As I mentioned earlier, dispensing errors, you'll hear us investigating those due to your involvement in the process. HIPAA violations, these could be intentional or non-intentional. We've had both. A lot of times the unintentional is selling the package to the wrong patient, and that thus a HIPAA violation occurs. But we have had a couple instances where technicians intentionally disclose patient information, usually on social media, but did it intentionally. Failed and refused employer drug testing, we investigate those when reported to us. And then any kind of criminal activity that gets reported to us, a lot of times will end up being investigated. Board actions, if you get in trouble with the board has different options. There's public records, employment disqualification list, or the EDL, that prevents you from working in a pharmacy for a set period of time. Conditional registration is more like a form of probation. You can continue to work. People with past drug issues and stuff, those probation terms may include the board's random drug screen program. Non-public actions could be letters of warnings or concerns. You can continue to work in a pharmacy, but you may be asked to respond back on corrective action. And then it might also, it also warns you that future violations may lead to the board taking further, stronger actions, such as an EDL or conditional registration. Just for discipline, just to give you an idea of how often the board disciplines, these are from the last fiscal year. So this was the fiscal year ending June 30th of 2021, so just ended this summer. We had 15 EDLs. You can see the majority of them there are diversion or attempted diversion. We had a couple people who who violated their conditional registration terms and were thus got EDL for that. And then conditional registration, you can see that the majority, the lead one there is theft. These are non-drug thefts. So as I mentioned, all the different types there, we've probably seen it all. Unauthorized dispensing, we've seen some technicians who, without the pharmacist's knowledge, went ahead and prepared and dispensed something for various reasons. Criminal history, those are usually on an application where someone has a previous criminal history that the board issued a conditional registration on. And then HIPAA violations, I talked about that. And then positive drug screens is another reason the board placed someone on conditional registration. So this is just an example of over the last 5 years what discipline looks like. And as you can see, that the amount of employment, the EDLs, the employment disqualifications, has been declining fairly drastically. But conditional registrations have pretty much leveled off and pretty static there. But the number of disciplines is definitely, EDLs has been dropping over the years. I don't think I can point to one specific thing that's causing that. It's probably a variety of reasons. House Bill 600, I mentioned it on some other slides, and I told you I'd talk about it. What is it? It's a law that says in order to have a license with Missouri, a professional license, you must be up to date on your state income tax. And so the Department of Revenue will run reviews of everyone who's licensed to see if they are up to date on paying their taxes. If they're not, what will happen is you will get letters from the Department of Revenue, and if you don't work it out with them, they will eventually notify the board, and the board has no option here. It's an automatic that you will be suspended if you don't get it resolved. So you'll get a letter from the board telling you that. If we still don't get it resolved, the Department of Revenue will tell the board that we have to suspend you, and then you'll get a letter that you have been suspended, and then we'll put your name out on the email alert and on the board's website that you have been suspended. So do not disregard letters from the Department of Revenue or from the board if you get one. They will not go away, and you will eventually be suspended if you don't get them taken care of. Just a quick update on some resources we have that have been updated recently. The Pharmacy Technician Guide, and to the right here is what it looks like. It's a, I believe, 11-page document on questions and answers specifically related to technicians. We just updated that in July. We also just updated the Practice Guide. If you're not familiar with that, that is a, I think, maybe 100-page document, and it just talks about all kinds of activities, answers questions about activities. We try to put it in layman's term there, but those are two guides that technicians can always go to. They can be found on the board's website, noted here. And then if you ever need to contact the board, you can contact the board office. I would recommend doing it by email. Here's the general email address. You can always contact board inspectors. If you don't know who your inspector is or how to contact them, it's on our board website. If you go to board information and then click the inspector link, you'll get a table showing by county and then zip code for the St. Louis area. And then we have online method on our website. It still says new. We've been doing it for 1.5 years now, so it's not new. But you can submit a question either to the office or to the inspectors by submitting a question online there. So now our executive director, Kimberly Grinston, has joined us, and she's going to talk briefly about technician well-being.
Good afternoon, everyone. I think it is afternoon. Again, I'm Kimberly Grinston, Executive Director for the Board of Pharmacy, and thank you to everyone who is joining us for this webinar. Pharmacy technicians are really an important part of pharmacy practice. You all play a frontline role in helping to keep Missouri patients safe. So thank you for all that you do. Thank you for your interest in continuing compliance and assisting your pharmacy. I know, as with all pharmacies, this has been a busy time. It's not that pharmacies weren't busy before COVID-19, but I think COVID-19 has just added a lot of additional responsibilities and work, not just for pharmacists, but also for you as technicians. The world has changed. Pharmacy has changed with that. And so we thank you for all that you all are doing as part of helping our pharmacies meet patient needs during the pandemic. And as we walk through the pandemic, we get a lot of questions and comments, and we've received a lot of your emails, a lot of your anonymous emails to the board, just about pharmacies and the stress that you are under right now. I fully recognize that not only is this an unprecedented time, but this is unprecedented in several ways. And it's impacting us financially, it's impacted us socially, it's impacted some people physically, and also it impacts us mentally as well. And so one of the things that I wanted to share with everyone on today is just some of our well-being resources. Again, thank you for all that you do, but we need to make sure that you as pharmacy technicians, that you all are taking care of yourselves. As you deal with the stress of the pandemic, I understand patients, the pharmacy, everything may be more stressful than ever. One of the things about being well is making sure that you are in a good place to continue doing all that you do. And we wanted to share some resources with all of our licensing communities that are out there. You'll see on the screen right now some free resources that are available. If you look at the board's June newsletter, there's a lot of additional information on resources, well-being resources in the newsletter. But I want to share with you just a few of them that are in the June newsletter. Of course, the Suicide Prevention Lifeline. If you need help, I encourage you strongly to reach out to someone who can help you. All of the resources that you see on this page are free for your initial call, initial conversation, and they can help direct you to someone or somewhere where you can get additional assistance. So please look at some of these resources if you need to. The National Suicide Prevention Lifeline. I want to note some of these resources may not be for you. They may be for other technicians that you work with, family members, children, even pharmacists that you may work with. The National Helpline, you'll see the number there, the crisis text line. If you don't want to call, you can just text MoSafe to 741-741, and they will reach out and help connect you with resources. The Deaf Crisis Line, if you know someone who may be hearing impaired, there is a free resource for them. Grad Resources, this resource is focused on students, and it just, again, helps connect you to well-being help and resources. The Veterans Crisis Line for all of the veterans and active military members. First, thank you for your service. Secondly, we want to make sure you are taken care of as well. So we provided the Veterans Crisis Line for you also. Again, these resources are in the June 2021 newsletter. We also have a video link that will help talk about some of the things that you may be facing, healthcare assistance providers, workers right now during the COVID-19 pandemic. And then the Missouri Department of Mental Health has also established a list of some resources that you can find. And all of the resources on their website are free. And again, they can refer you to some place where you can make sure that you are doing well as during this pandemic also.
Thank you, Kim, for stopping in. We're now going to take some questions. If you'd like to submit a question to us, on your toolbar, type it in and then hit send, and we will see if we can answer some of these.
First question we have is technicians that are under investigation and they apply for a job, do they have to disclose that they're under investigation to their potential employer?
The Board of Pharmacy has no such requirement, but we would highly advise that they do that. It may be a violation of the employer's policies and procedures, or the application process, but the board specifically doesn't have anything about that.
On the vaccine protocols and the new functions that technicians are able to do with vaccine administrations, do they have to sign that protocol for administering vaccines?
No, a technician would not be signing the protocol. They're going to be doing it under the authority of it's being delegated to them from the pharmacist who signed it. And just to go back, not only they don't sign the protocol, they also do not need to submit a notification of intent like a pharmacist does. And that also applies to interns. They don't have to apply or sign a protocol.
Are technicians allowed to take prescriptions off of voicemail?
The Board of Pharmacy doesn't have anything that would prohibit that. Again, an employer might prohibit that or have, something to do relative to that, but the board does not have a regulation that would prevent that.
On HB 600, does that apply to all medical professionals?
It's anyone, I know it's anyone who has a professional license. I don't know who all it covers. I can only speak for like what professional registration covers. So yes, it would be doctors, dentists, nurses. I don't know what other professions out there, non-healthcare, that it covers.
Another question on HB 600, what type of time frame is there when the board notifies you that you'll be suspended when you actually become suspended?
I don't know if I can actually answer this. I can tell you when the time that Department of Revenue is reaching out to you, I'm not sure. Once we get notification from Revenue, you have I believe the letter you get says you have 30 days to resolve it, or then you would be suspended. But again, resolving it means working out, I believe it's working out something with the Department of Revenue. It may be you get it resolved all together and nothing was owed, or you find out you pay it, or maybe it's some kind of payment plan. I don't know. Revenue would need to answer those questions. But I believe our initial letter says you have 30 days. But by the time you got our initial letter, you should have had well aware from Revenue that you have an issue, and hopefully you're not hearing about it first from us.
So one other thing on the HB 600, that's another important point. You just want to make sure you keep your address up to date with us so that when we do send you the letter that you actually get it. I know Revenue, they give you a couple warnings, but I think ours may be pretty quick. Because
it is 30 days, but again, we wait till we hear from Revenue again that you haven't resolved it. So, but yes, if you don't keep your address up to date, you won't be getting the letters. So it is important, and you can make address changes on the board's website.
Question came in, who is responsible for monitoring the location of a remote tech for those required to be located in Missouri?
I'm not 100% sure I understand the question. If you're asking who's responsible for the site and what goes on there, it'd be the pharmacy who you're working for. And then the board would be the one to make sure that they're located in Missouri. But right now, due to the COVID waiver, they can be outside of Missouri. So you don't need to worry. But once the waiver goes away, then if you're outside of Missouri, you will have to be brought back into Missouri.
For the national certification programs, PTCB for sterile processing tech, if you can't find any programs in Missouri, what can you do?
I think you would need to contact that organization and find out what's available. The board has nothing to do with certification. We don't refer people to programs, and we don't provide any of the programs. So I really can't provide any information on that. I would go back to the certifying organization there.
Do technicians need 20 continuing education hours to renew?
Missouri does not require any CE to renew your license. I know there are some states that do, but Missouri does not. Speaking of CE, we do issue it for technicians. I know some of you will need to get that for maybe for certification. I cannot answer whether RCE will count for that, and I cannot answer if RCE will count for another state if they require CE. So if you have a CE requirement by someone else, you should ask them if CE provided by the Missouri Board of Pharmacy will be accepted. Do not automatically assume that without checking with them. We do have clarification from the board office that they have 90 days to get after a House Bill 600 letter goes out from the board. So it looks like it's 90 days, not 30 that I originally said.
When does the waiver expire for remote data entry outside of Missouri?
Right now, it expires at the end of August. We are waiting for word from the governor's office on all the COVID waive, all the statewide COVID waivers. We're expecting to hear something any day or any minute, but we have yet to hear that. So if you ask me now, all I can tell you, it expires on August 31st. But the board will be sending out a email alert once we get notice of them being renewed.
How can a pharmacist oversee HIPAA compliance for a tech working remotely, such as visible patient info and what other people can see in their household?
I don't know if I can fully answer that, but some things to do is, one, they would have to be properly trained so they understand what a violation is. Also, there probably depend on the technology that you're using. There may be ways to track unauthorized use and stuff like that. I would not be an expert on that. If you need guidance, you might reach out to more of a HIPAA guidance person on that, but it is the pharmacist, the pharmacy's responsibility to protect that information. So it is something to consider when you consider allowing someone to work outside of the pharmacy.
Is Missouri going to require in the future techs be certified?
The board's had discussion over the years about this. They've never taken the approach to require it for all, but as you can see, as the board writes new and revises rules to allow more activity, they have been adding that requirement for certain activities. But at this time, I would say I don't see anything on the horizon that it would be a requirement for licensure. Okay, well, we're almost out of time. We have a lot of questions we didn't get to. We're sorry about that, but we'll have to end the webinar here shortly. So I need to go over a few other things. The next webinar, September 23rd, we'll have our annual compliance update question and answer session. And then on October 7th, my guest is going to be someone from the MoHealthNet Program Integrity Unit who will give a presentation. As I said earlier, we record all our webinars. You can find them on our website. Previous ones from this year, we had a COVID update, a regulation update, and just last week we did a legislative update. For CE, in order to earn CE, you must complete the post survey that will pop up at the end of the program. So do not close your browser. Once I announce that I'm closing the webinar, a window will open that says I've closed it, I've ended it. You hit close. Again, do not close your browser, and the survey should pop up. Answer the questions and click submit. If you do not get the questions online, you may email us at compliance@pr.mo.gov and we will email you the questions. However, you must submit the answers back within 24 hours in order to receive CE credit. Again, we no longer mail certificates, we email them, so please be on the look, check your email for those. The webinar last week, the certificates were emailed yesterday. So I want to thank everyone for attending the webinar today. I am now going to close the webinar.